Today we're going to be discussing the Stat-A-Dyne shoulder device by Lance Medical. The device was designed to address adhesive capsulitis in the shoulder, which can occur a variety of different ways. There's primary or insidious adhesive capsulitis that occurs for known origin. And then there is secondary adhesive capsulitis that typically occurs after some type of surgical procedure or insult to the shoulder. In regards to the device itself, we're going to start with the control knob on the device that actually allows you to choose what position you would like the arm placed in regards to external rotation or abduction. There is research that indicates that if the shoulder is placed in 30 to 40 degrees of abduction, you can actually influence the shoulder capsule more advantageously. So let's start there and move the shoulder in about 30 degrees of abduction. In order to do that, I simply squeeze this lever, move the gearing system or spindle up towards the armpit, and bring my shoulder into roughly 30 degrees of abduction. I'm now going to replace the device back into the external-internal rotation mode simply by moving the spindle towards my elbow. When looking at the shoulder capsule itself and realizing that the anterior-inferior part of the capsule is typically what becomes contracted, most patients who use a Stat-A-Dyne shoulder will only use the device for external rotation in order to regain shoulder flexion. The reason for this is because Dr. Donatelli basically proved that for every 1 degree of external rotation you gain 1 to 1.5 degrees of shoulder flexion. Dr. Donatelli is a PhD in physical therapy. Numerous therapists utilize his textbooks and resources when they're being trained in school, both PT and OT. Now, when we're looking at the shoulder device itself, what we're going to actually encourage the patient to do in regards to static regressive stretch is they're going to take this knob here and they're simply going to move their arm into external rotation, and we instruct them to actually stretch their soft tissue in their shoulder to a 3 on a 0 out of 10 subjective stretch scale. That 3 can be equated to reaching over to touch your toes, and you feel that uncomfortable sensation in your hamstrings. Not exactly pain, not exactly comfortable, a stretch sensation, and that's the same perception we would want somebody to have in their shoulder. They're going to do this protocol 3 times for 30 minutes, but when we encourage the patient to use our device, we're going to encourage them to think of that as 6 5-minute treatment sessions, which will equal 30 minutes. You can certainly advance that treatment session if you want to in regard to longer wear times, if that's indicated for the patient's progress. Now what I'm going to do is I'm just going to show you the overall functionality of the device, show you some of the advantages in regards to design when it comes to the Stat-A-Dyne shoulder. So if I bring the device into external rotation, what I want you to realize about the product is that it has been intentionally designed to go beyond anatomical norm. Why is that? Well, because there are competitive products in the industry where the weight of the extremity can cause the product to actually mechanically give in this fashion. So if your product goes beyond the anatomical norm, we can make sure that we achieve true anatomical norm for that patient. Secondly, if the patient's arm's larger and they have a lot of soft tissue displacement, we call that soft tissue give, that can also throw off your range of motion numbers on the actual device. So the Stat-A-Dyne shoulder goes beyond anatomical norm to overcome mechanical and soft tissue give. An additional reason why it goes beyond anatomical norm is because we wanted to have a device that went well into external rotation. We did this in the design process intentionally, knowing that we would be calling on sports medicine, occupational therapists and physical therapists, as well as sports medicine physicians who are seeing a high-level athlete who's going to need more external rotation than your average Joe population. The device also goes well into internal rotation for those exact reasons. For that patient who needs a lot of external rotation for a sporting event, baseball player, tennis player, they also need more internal rotation to decelerate the arm after a pitch or after a serve. If I want to move the arm into abduction, we simply instruct the patient to shift their spindle from elbow to armpit. So patient simply grabs the spindle here, squeezes it, moves it towards their armpit. They'll hear a click, and now the hinge behind my shoulder, close to my scapula, is the hinge that's going to cause abduction. One of the other features that we intentionally designed into the Stat-A-Dyne shoulder is this elbow X-strap system. As you can see, it harnesses my arm very well. We knew that if the patient did not relax their pectoralis and their shoulder girdle, they would never truly be able to isolate their soft tissue well when trying to cause plastic deformation. So we saw some patients on our original design that did not have the elbow X-strap holding on to the edge of the cuff of their forearm splint, and that is no longer needed. The patient can completely relax their arm. Tricep and elbows harnessed well. Maximum relaxation occurs at the shoulder girdle, which allows the best amount of plastic deformation to occur in regards to when the patient makes their finite adjustments. In regards to measurements for this product, we're finding that 90% of the population actually fits into a medium cuff. And so when you identify a patient who you would like to utilize the product for, unless your patient is not an absolutely petite patient or a patient who's much larger than the average Joe population, we would request that you recommend to your representative that a medium cuff would be utilized. So shifting back down towards my elbow, I'll show you internal rotation on the product. We need internal rotation not only for those sporting activities, but also to tuck our shirt in, to get a wallet out of our back pocket, those types of activities of daily living. And so the product certainly addresses internal rotation as well. Moving the spindle back towards my armpit, I'll bring myself back into adduction and bring the position of the product back into about 30 to 40 degrees. Shift back into external internal rotation, and once again, the primary motion that the patient will utilize in order to regain shoulder flexion is going to be external rotation. Thank you for your time in learning about the Stat-A-Dyne shoulder product.